You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. My first guest says nobody should be wearing a loose-fitting denture. We're talking about dental implants today. With us, we have Georgia's go-to implant dentist, Dr. Jonathan Bullard. Dr. Bullard, welcome to the program.
Thank you for having me, Randy.
Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible.
I did.
Now, for people that don't know your center, I mean, who's the typical dental implant patient that you see?
Well, Randy, we have two main types of patients that we see that want this type of treatment. The one patient, they've got lots of decay in their mouth. They've been battling tooth decay and gum problems for years, and they're kind of at their wits' end looking for a solution. And these people, they feel like they have really bad teeth, and a lot of cases they do, and they're looking for a solution because they're concerned they're going to end up in a denture, and they don't want to go down that road.
Okay.
The second type of patient that we get are the denture wearers, and these are people who they've been down that road, and unfortunately they had to take the step to go into dentures, and a lot of times it's been many years. And they may find us through a friend or just doing research online. Really, that's the main way people find us is just searching and trying to find someone that can help them with their problem.
So for these denture wearers, they literally could come in one day and the next day get a brand new upper and lower set of teeth that don't come out.
That's
Is
right,
that
Randy.
rare or something you do a lot of?
That's what we do all the time, Randy. We plan these procedures. We've got all the equipment in the office where we can image the inside of their mouth, we image their face, and we can put all that together and design their smile. And so when they come in for their surgery, after surgery, we take a few more images, and then we build their smile in a software, and then we mill those teeth out of a solid piece of, basically their temporaries are made out of a solid hard plastic. And then we characterize them for the individual patient. And then the next afternoon they come in, we attach their brand new set of teeth to their implants, and then they head out the door smiling.
So how old can you be to get dental implants, to get new teeth supported by dental implants?
Well, there really is no age limit. I've done this procedure on patients in their 90s. I have colleagues who have done it on patients who are like 100 years old. It really just comes down to quality of life.
Why would a 90-year-old want to do this?
It's because they want to eat and chew. They want to live their best life just like you do and just like I do. And it's easier to do that when you can enjoy your meals.
What's your oldest patient that you've ever done this for?
Well, I tell you what, Randy, I've had multiple patients in their mid to late 80s that have had this procedure, either the fixed teeth that are permanent or snap-in teeth. And in both situations, their life has changed.
Is the eating, is that what they like the most?
Yeah, I have a patient, and he loves to travel with his wife, and he's actually in process right now, so I'm excited for him. But he and his wife, they actually, unfortunately, but they both lost their spouses. They're in their 80s, but they found each other. And it's so interesting because I said, "Where did y'all meet?" And they said, "On the internet." I was like, "Oh man, that's pretty impressive." But we're working through the process, and what he wants, they bought a motorhome. They've moved to Georgia from the West Coast. They bought a motorhome, and they're ready to travel. And he said, the best thing when I travel is to go around to all the towns and try their different foods. And so, he doesn't want to be limited on what he can eat, what he can pick off the menu because of his teeth. And so he's excited, and a lot of times I'm just as excited or more excited than the patients because I know what it's going to be like because I've talked to all the patients who have had it done in the past. So it'll be an exciting day. It always is when they get their teeth.
So in Georgia, I guess you're in Martinez, is that right?
That's right.
Are there a lot of people wearing dentures or headed to dentures?
Well, I can tell you, Randy, based on the statistics I've found, 12% of the population is in some kind of a denture. And so that means in Georgia, the Mercedes-Benz Stadium, just based on the population in Georgia, we could fill that stadium 2 or 3 times with people who need this type of treatment.
So if there's that many people wearing like an upper or lower denture, why aren't they all doing this? Like, what's your take? They just don't know about it?
Well, if you're wearing a denture, you don't see a dentist. I mean, first let me tell you what their life is like before they got a denture.
Okay.
Somehow they had to get there, and that probably included not going to the dentist for a while, and then they had a toothache, and then sometimes they go to the dentist and find out, well, you got 1 or 2 bad ones. You take those out, And maybe you take the path for a while where you're repairing teeth. You get some root canals, fillings, but the risk for cavities don't change. So then they lose their teeth and they end up in a denture. And then, you've got your patients who go in.
So they're just afraid to go in.
Right.
They don't like the dentist.
Right. Well, their experience has been so distressing during that process, that they don't ever want to go back. And how else would they find out that there's an option like this? That's part of the reason I'm here today, is so those people can know that there are other options than walking around with a free-floating denture in their mouth.
Yeah, but what if you've been wearing a denture like 10 years, 20 years? Can you still do this? Or isn't it true you don't have enough bone to do it?
Well, that's a misconception. And I used to think earlier in my career that a lot of my patients didn't have enough bone for implants. But there are different techniques. We use different types of implants. We actually just completed a case the other day who 10 years ago, I would have just thought he wasn't a candidate. But we have special implants that can anchor in different areas of the upper jaw that can make that a possibility.
So even if you've been told elsewhere you don't have enough bone to do it, chances are you could do something. Have you ever had to turn anybody away? Like saying, I'm sorry, like in recent times, I'm sorry, we can't do anything.
Yeah, it's a very few and far between. But I can pretty much recall their names if that was the case.
So you brought some photos. What are we looking at over there?
I did. I brought a few. So this first case, she came to me. She had moved to Augusta more recently, and she had come to the point in her life she had been through a few other health issues that she had worked through. And a lot of patients are that way. They've worked through something. They've stopped taking drugs, or they've changed their habits, or lost weight, or they've been through a divorce, and they're just getting to a point where they're ready to change their life. And it's interesting. We try to change our lives, and we can lose weight, and we can get plastic surgery and makeup, and we can do all these things. But for a lot of these people, there's this reminder of what their life used to be right in the middle of their face.
Okay.
And they come to us, and it's exciting for me because we take these before pictures and we pull them up on the screen in front of the patient along with their x-rays, just to help us figure out, where we are, so we can figure out where we're going to go. And then, I always get excited because I go in the room and I look at the before picture, and I know, and my treatment coordinator, Ashley, she knows what we can do.
Like you see the end result.
Yeah, I do.
Now, but her teeth are pretty bad. Is that unusual to see something like this?
It's not unusual at all. They're walking all around our town. It's when you see them out, they don't smile. They're not going to show you. And now with everybody wearing masks, actually patients come in and they say, I'm so grateful that we're all wearing masks because I can feel totally comfortable walking around with my mask on.
That is interesting. So with her, okay, so she comes in, and what are her options?
When I saw her options were either basically go into a denture, or what she wanted and why she found us is because she wanted teeth to replace her bad teeth and give her life back, to give her teeth that don't come out, that are permanent, something that she doesn't have to think about. Those teeth that you see in the after picture,
it's a big difference, by the way, in the appearance.
Yeah, it's amazing. Sometimes in the end, I'll look at the before and after pictures, and you just can't. I can't picture them. If I look at one, I can't picture them the other way. If I look at them how they were, I can't picture how they are. It's the change for her in the way
she looks younger. That's for sure.
She does. I think a good set of teeth are worth about 10 to 15 years. That's right.
The other thing is, you told me in the green room, is it adds to your overall attractiveness. And I think anybody looking at this before and after, she's definitely prettier in the after.
Oh yeah. Two people right beside each other, if they both have perfectly good teeth and one just isn't smiling, and they just don't smile, and then someone beside the other is smiling, you're gonna find them more attractive because we smile with our mouth, we smile with our eyes, our body language, and it's amazing to see a person like this just step out of their shell, or look in the mirror and become the person that that they really are on the inside.
What could she eat?
She can eat anything she wants. She can eat steak. I actually had a patient the other day who said, yeah, I was eating a pork chop the other day with my new teeth, and I got in a hurry, so I just picked it up and started gnawing it off the bone. It's like, man, that's amazing. But I had a patient come in the other day she's in her 80s. She explained the whole road she went down. She's a very gregarious, articulate person, and but she knows exactly what she wants, and she wants fixed teeth. And she was describing to me in such great detail what she wants. It doesn't have anything to do with how they look so much, but she was talking about, I want to eat a salad. I want to eat cucumbers. She said she wants to eat rutabagas. I was like, man, I don't eat rutabagas a lot, but
okay.
if that's what you want,
okay.
that's great. And it's so great to hear her say that, for her to feel confident that we can do it for her, and to personally feel confident that I'm going to be able to make it happen for her. It's very nice. It's exciting.
Now I know you have a lot more photos, but on this woman, on that before, these people have, I guess, what you call gum disease, right? Right. It's an infection.
That's right.
Their teeth hurt when they eat and chew.
Right.
Are their gums too bad to get dental implants, or it doesn't matter?
No, it's it's, in some cases we have to get some people cleaned up a little more than others and get things healthy. But really, the disease, gum disease, is disease caused by bacteria that live on the teeth. Okay. So once the teeth are not there, we help them maintain their new implants, and these patients function just like you and me.
So this woman, she's smiling all over town.
Yeah, she is. One of the things that I'm always excited to hear is for a patient to say, or sometimes I'll tell a patient, I'm looking forward to when someone just tells you, hey, you have nice teeth. They don't know what was done, what's going on.
Just you just have a nice smile.
Yeah, just a random person.
Because those look real, by the way.
They
look good.
They do, thank you. Let me show you this next patient.
All right.
And this one is certainly special to me. She's one of my, either the first or second full arch of fixed teeth that I did. Okay. It was after, so that was a transformational period in my life. Okay. Going from...
like a snap-in, snap-out set of teeth?
Yeah, we had done some snap-in, and we even changed our technique for snap-in teeth. And we have an incredible way of doing that that is so solid. But she was one of my first cases for fixed zirconia teeth. And in her case, she had, I believe, an automobile accident at a young age. So she had been dealing, I believe, since her teenage years with wearing a partial. Okay. So she's in sales, and in sales, smiling is a big part of things. In this case, this patient came in, she knew exactly what she wanted. She had failed bone grafts, trying to rebuild just that section of her mouth, and multiple attempts, and nothing was working, and she wanted her teeth to look perfect. Okay. So, weighing all her options, she still has her lower teeth, and her lower teeth are doing fine. And we actually did some repair work on the lower teeth to keep them, because if we can keep healthy teeth, that's what we do. But in this case, we gave her a full set of teeth that don't come out. And if you just look at her after picture, you can see. I mean, this is another case. The hair looks different afterwards. She's getting her swagger back in her life. And it's so funny, because I was in the airport on the way here. Okay. I'm walking down through the Augusta airport, and here she is sitting by herself. And so, I sat down with her, and I told her what I was about to do, and I was going to talk to you. And I asked her, I said, what has changed in your life since you've done this?
What'd she say?
And I'll tell you the most profound thing that she said. There's some things that I've typically heard, but I've heard this. Well, I've heard this many times. But she said, I can tell you with no hesitation that this was the best decision that I've ever made in my life. And she's lived some life. She's been through some things in life. But to say that getting her smile back was the best decision she ever made. Good. I mean, that's a good little story. Right before you get on a plane to come here and talk about this, and you see one of your patients. Yeah. She says that. Oh man, it was moments like that. We have so many of those, but it has such an impact on me. And another thing that she said is she doesn't even think about it anymore. They're just her teeth. If you can imagine, she wore a partial for years. And I'm sure she thought about it all the time. She thought about, how is she smiling? Does she have to hide her smile? Does she have to take it out? Is it going to break? And
That's
now,
a very good point. It's like you and I, we don't think about our teeth, right?
No.
Except for when we're brushing them, and even then you don't even think about them.
No, once everything's in there, it just becomes part of you.
So like we were talking about the denture wears, that you'd love to see more denture wears.
Right.
But their whole life revolves around kind of
Oh, yeah.
that denture.
Yeah, every day. And, you know, and some people, their spouse or their significant other, they don't even know they have dentures.
Is that right?
Yeah, you know, they told me that in dental school. I didn't necessarily believe it, but it's the truth. You know, they wear their teeth during the day, they take them out at night, put them back in, and their significant other never knows.
So no more dentures. You can wipe out dentures where you are. Is that your plan?
I'd like
You're
to.
young enough to do it.
Yeah, I've probably got another good 30 years in it. We'll see.
Okay, good. Yeah, I knew you have more photos. And by the way, we're kind of short on time, so I'm going to rush you a little bit because I want to get through every one of those.
Okay. So this next patient, he came to us, and this was another case where he sought us out. You know, he looked up, saw this is what we do, and he did a lot of research. He's a very intelligent person, and he came to us and said, this is what I want. We talked to him about what we do.
He didn't want a denture.
No. He
Is
didn't.
is that an option of this guy? You couldn't save those teeth.
We could not.
Okay.
No, he knew where he was, and it's so common for patients to just be afraid, and they just get in a situation and their teeth get to a certain point, and they don't like going to the dentist, they don't like having dental work done, and they end up in the position where they know they need to do something totally different. So this patient, he came in, and you know, he's a leader. He's in leadership. He's a very smart guy, and it's one of those situations where he has so many things going for him, but there was one thing holding him back, and unfortunately, again, it was right in the middle of his face.
Teeth.
Yeah, his teeth. So
what does he get?
He gets, these are fixed teeth that stay in his mouth and they never come out. Yep. Now we just see him every 6 months, just like you go to the dentist every 6 months. Make sure everything's going well, and he's just going to live his life.
He can eat whatever he wants.
That's right.
So what do they like more? They like the way it looks, or what they could eat?
You know, it's really a mix. You know, there's some people who come in and they say, I want to eat. Just like the patient I was telling you about that's been in dentures for so long. And when you've been in dentures for a long time, a lot of these people who their teeth are bad, they're still able to eat okay. The people in dentures, you know, the best denture, you got 25% of the bite force is someone with teeth. Okay. So life is, and you can't taste anything. The denture covers your palate. You try to have a nice wine that you like or a spicy food. Part of your taste buds are in your palate.
Okay.
So just actually, you know, I'll tell you another story. I was just getting into dental school. Like, I'd been accepted, waiting to get in, and I had a relative who was older, you know, much older than me, and he had been through it all. He had dentures since he was 25 years old, that was probably in the 50s or 60s. And then right about maybe when he was 70 years old, he went through the whole process. He actually got snap-in teeth, but we were playing cards, and he pulled me aside outside, and he pulled his teeth out. I think he had maybe had a couple of drinks, but he was showing me, and he said, when you get in dental school, you make sure you learn how to do this. He was like,
that's nice.
Yeah, he just explained to me how it changed his life. He could taste his foods.
But you went beyond that. You learned how to do teeth that are permanent fixed.
Yeah.
That don't come out.
Yeah, I did, and I would like to think that he would be, proud of what I'm doing.
Good. Time for a few more.
All right. Here's another case. So this is a guy who came in, and we called him in the process. A lot of people lose their upper teeth first, or their upper teeth go first, but their lower teeth are okay. In this case, we were able to add a single implant on the lower to give him a nice full bite. The upper teeth, it was either a denture or implants. So we got him a nice set of fixed teeth, a full set of upper teeth, and you can see. I mean, he looks like a different person.
Looks good. He can eat whatever he wants.
Whatever he wants. He's healed up now. He can eat steak. He can eat vegetables. You know, a lot of patients are more excited or talk to me about they just want to eat a salad again. You just can't do that with a denture. Or if you do, you're swallowing whole leaves of lettuce.
Yeah.
Let me show you another picture here. And this one is really special to me. This gentleman, He is my first cousin.
Okay.
Yeah, Dennis. And, and you can see, I mean, he had been down that road that we're talking about.
So that's his smile on the before.
That is his smile.
He's not showing any teeth.
Yeah, before the picture, he had a really long mustache, because a lot of men, they'll grow a long mustache to hide their bad teeth. And that's what he had done. So this was right before we did the procedure, so he shaved all nice and clean for us. And then, his options at this point were either a denture or dental implants.
But now with a first cousin like you, right? You can't allow it.
Yeah, that's right.
It's probably not even legal in your state, right?
I know, right? You're like, yeah, so that was so exciting because, Dennis used to take me hunting when I was a little kid, and he took up time with me. And, he was always an attractive guy, handsome guy, and just always kind, would do anything for anybody, still will. And so it was, I knew, we had talked about maybe doing this or maybe doing that over the last several years. But when it came down to it, we talked it over, and I knew what I could do for him. And so he trusted me. We went down the journey together, and just like the transformation that I see in so many people, to be able to see that in, someone that I've loved for so many years.
So upper and lower teeth that don't come out?
Yeah, they don't come out. They're solid as a rock.
Does he say, look, I should have done this a long time ago?
Just like everybody else. That's right.
Their biggest regret is I should have done this earlier.
That's right.
Interesting. Good. You have time for a few more. And I'm going to rush you through these because I want to show all of them. It's good.
Okay. So this is a case where, some of our patients are younger. And a lot of times the situation, there's different reasons people have dental problems. In his case, he had just a lot of decay and got in the situation where he didn't want to keep fighting to patch things along, to drag things out. So this is a case where we actually these are snap-in teeth. And the way we do our snap-in teeth is the way that I set up a snap-in set of teeth. I put the implants in the same locations that I would for fixed teeth, in case a few times along the process the patient has said, you know what, I want the fixed teeth. But I place the implants in a way where it's simple conversion. Just a few images.
So they could start with a snap-in, snap-out set of teeth.
Yes.
And then they could convert to teeth that don't come out.
That's right. I set up.
So it's just a little bit more expensive. To do the fixed teeth.
That's right.
Okay.
Yeah. So I set these all up that way. But you can just look in his eyes, in his smile.
He's looking
his
good.
Life. Yeah. His life is totally different. Let me show you this next patient here.
Okay.
This is a case where she had been in an upper denture, didn't like it. It was not an attractive setup of the teeth, and then she was in the position where she was going to lose her lower teeth. And everybody who knows anything about dentures knows that lower dentures are terrible. So for her, we were able to stabilize. We'll do two things. We're able to correct the plane of her smile, or put the teeth in the right location in her head.
Okay.
Or in her smile, and we were able to support those dentures where now they're rock solid. She can eat whatever she wants.
And they snap in, snap out.
That's right.
No more adhesive?
That's right. Yeah, the best day is when we can throw the adhesive in the trash.
So you say these snap in, snap outs, you could drag them around the office. You said that.
That's right. Well, that's what I tell the patients.
That's an exaggeration, but they're firm. They're pretty good.
No, it's not an exaggeration. I don't literally pull them around the room, but the way we set up these dentures is we can literally, once they're snapped in, they don't move up or down, left or right. You can literally, pull the patient around with the denture, and
so
it
they're
doesn't
strong.
move.
And they could eat and chew and eat salads?
Yeah.
Things like that?
They can.
Time for just one more, maybe two.
Yes, I asked a patient the other day that has this. I said, well, what have you been eating? And he said, everything.
Okay, good.
Okay. This is another case where this patient had been in upper and lower dentures for a while, just living through all of that for years and years, and we're able to, despite him having a minimal amount of bone, we were able to use some special implants, and in a day's time, we had him in fixed teeth that don't come out of his mouth.
Good. Very nice.
This patient, he came to us looking for solutions, and he's got a set of teeth. His lower teeth are snap-in, rock solid. He's actually a singer, and he plays the drums in a band, and he's able to sing, be confident, not worry about things moving around, and he's living his best life.
We are completely out of time, but I want to ask you this because you're a dentist. You probably think that the smile is the most important thing. How important is it?
Well, Randy, I tell you, the smile to me is certainly one of the most important things. You know, it's, you know, and Hollywood's done a lot of this, but you can look at multiple surveys. I think it's Men's Health magazine.
Okay.
It's, you know, they talk about what are the top 3 things that people find attractive in general, but probably in this case in men. And as far as the importance of a smile, I mean, it's again, it's right in the middle of your face. I mean, it's what you show to everybody. It's how you eat. You know, and we get so much enjoyment in our life from eating. You know, like we're always thinking, hey, where are we eating for breakfast? Where are we eating for lunch? You know, hey, what's for dinner? And I got a date tonight. You know, like what are they going to think about me? You know, before you have a date, you're looking in the mirror, working on your hair, making sure your eyebrows are just right. But if there's something parked right in the middle of your face that you hate, you know, it's going to affect your whole life.
So this is, as a dentist, you probably think, I mean, this is one of those things you could fix. Like an easy fix.
Right.
I mean, it's technically demanding on your end.
Right.
But it's somewhat of an easy fix.
That's right. Well, we try to make it easy for our patients. It is a demanding thing on our part, but we work on our processes in our office where, you know, we've got our workflows down to where it's smooth. You know, we can,
like 3 appointments, they could actually get their new teeth.
Right.
Is that right?
Yeah, they can undo basically a lifetime's worth of damage in a couple of days.
Couple of points. Okay, final message. We're out of time. Somebody watching this, maybe they're wearing a denture, or maybe they have the bleeding gums, the bad breath, the loose teeth. They're headed to dentures, and they've heard what you had to say, but they're still afraid. What do you say to them?
You know, we see patients who are afraid every single day, and when they come in, they feel like they're the only one because no one talks about it. You don't go to your friend and say, "Hey, I need this thing, but I'm afraid." You know, and so a lot of them feel alone, or they feel like, you know, that's unique. But we literally every day see people who are afraid, they've been avoiding the dentist, they're self-conscious. A lot of patients are just crying in my chair before we ever start, just because they have to say out loud how they really feel about themselves.
So you invite them in. Is that the main point? Like if somebody's watching this?
Oh yeah, I would tell them.
Just start with
just come see us. You know, and what I tell my patients is, you know, I'm just a regular guy. You know, I feel fortunate that I went to dental school. I've learned all these things, but I'm just like they are. You know, I'm just another human being, and the way my team will treat them like family. They just come in, we'll have a consultation, and it's no commitment to being treated. So I would say to them, just come and see us.
Okay.
Just come and find out what your options are. You know, we'll help you understand where you are, and we'll understand where you want to go, and we'll see if we can put together a path to get you where you want to be.
All right. I want to thank you for coming to the show. Good stuff.
Yeah, thanks for having me.
And these photos are on your website if somebody wants to take a look?
They are. We're going to be working on having these and adding more on the website.
Great. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez for now. I wish you could help.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.